Today we're going to do one of my favorite pair of sequences. We're going to join the Rebalance sequence with the low back decompress sequence. Now this is great for those of us who feel we have pelvic instability, which can lead to knee pain, low back pain, balance issues. Plus it just helps us feel more upright and helps the breath travel the entire channel of the lungs and the spine. So you're going to need your Melt full-size roller. You can also use the Melt half roller. Today I'm going to use the full roller, and we're going to start with our rebalance sequence. So to get on the roller, make sure that you line up the roller at the very bottom of your glutes, and you're going to gently guide yourself on and then roll back. And what you want to do is make sure that you touch the top of your head and that you still have your head on the roller, and then just find the bottom of the roller and make sure that your sacrum and your pelvis is as supported as possible. Fully supported is ideal. Every time we get on the roller, first thing we do is gentle rocking. So my hands are going to be out in a gentle A-frame. My feet are hip width apart, and I'm just going to slightly tip off side to side. And doing this gentle rocking allows our nervous system to acclimate to the fact that there's pressure along the entire length of our spine, which is not a normal position for us to be in. So as you tip side to side, make sure that you are moving as one unit. So if you were to tie a string from your nose through your sternum to your belly button pubic bone, everything is moving as one unit. Catching yourself just before you fall off the side. If you get motion sickness, make the movement smaller or go slower, or just gently keep yourself here and do some breaths. Now what we're going to do is we're going to do our 3D breath breakdown. I'm going to have you place one hand on the belly, one hand on the chest, and we're going to breathe depth into our body. So we're going to breathe from floor to ceiling, front to back, in equal timing. Not the biggest breath you can, but we're going to go ahead and inhale and exhale, bringing our awareness to breathing depth in our body. One more time. Inhale. Exhale. Moving your hands along the side of the rib cage, we're going to breathe width into our body. So I want you to gently try to expand the width of your hands through your breath. Inhale. Exhale. Move the hands up. Pay attention to the upper ribs. Inhale. Exhale. Let's breathe some length into our body. So one hand goes on the collarbone, the other hand goes on the pubic bone. This is more of an energetic awareness sort of breath, but you're trying to picture creating space in between each vertebrae. So we're breathing top to bottom. Go ahead and inhale. Exhale. Think about reaching the crown of the head towards the wall behind you and your pubic bone towards the wall in front of you. Let's breathe some length. Inhale. Exhale. So there was our focus on the inhale. Now what we're going to do is focus on the exhale. This is our 3D breath. We're going to place both hands on the belly. Elbows can rest on the ground. We're going to inhale into all 6 sides, front to back, side to side, top to bottom. And on our exhale, we're going to really focus on making a sound to feel the cylindrical contraction of our entire body. So you can either make a sh, s, or h sound and make it a nice, slow, extended exhale. So we're going to breathe into all six sides, front to back, top to bottom, side to side. Make your sound. Hold it there. One more inhale. Different sound. Hold it there. Inhale all 6 sides. Normal exhale. Feel and follow the cylindrical contraction of the torso. Hands at the side in the A-frame again. Do some gentle rocking side to side. Notice if your body catches itself a little quicker than when we started. That's a good sign that your body is recalibrated to its center of gravity, that your autopilot is back online, and that we've reset the diaphragm to allow us to breathe into all 6 sides of our body. Come back to center. Let's slowly come off the rollers, straighten a leg, drip yourself off, hips, shoulders, head. Lie on your back really quickly and just notice where you're at. You might feel like you have a nice contact with the ground with your shoulder blades. You might feel like the mid-back is contacting the floor instead of there being a wailing arch of a low back curve. Speaking of your low back curve, it might actually start at your belly button and end at the top of the hips. If that's the case, your low back curve is in a nice spot. If we're going to make it a little bit smaller, what we do next is going to help with that. Notice your pelvis. See if you can feel a pokey prominence of a sacrum on the floor, or if it feels like 2 evenly weighted butt cheeks. The work we just did with the rebalance sequence helps to reset the diaphragm, which also helps to position the pelvis into a more ideal position. Finally, notice if you can sense the back of your legs on the ground, or if one of them feels higher up than the other. If it feels a little bit uneven, no worries, no crisis. We're going to see if we can make some changes now with the low back decompress sequence. So let's go ahead. We're going to grab your full roller again, or the half roller if that's what you're using. Bend your knees. You're going to bring the roller up behind your pelvis, widest part of the pelvis. Make sure that you can wrap your thumbs around the back and not hit your thumbs onto the roller. They should be able to glide smoothly around your pelvis. Feet are hip width apart. What we're going to do is take a breath in, exhale, sink those lower ribs to the ground, and then we're going to go ahead and make our triangle with our hand. We're going to do a little bit of a tuck and tilt, a modified tuck and tilt. So inhale, exhale, curl the pubic bone in towards the nose. The feet are light. You're not pressing into the ground using your glutes or hamstrings. Inhale a sip of air. Exhale, we're going to tilt, platforming the sacrum flat on the top of the roller. So my sacrum stops when I get to flat. I don't keep continuing to arch until it's over the roller. I want to stop at the top. Pelvis feels nice and heavy. We're going to breathe in. On an inhale, curl the pubic bone towards the nose. My hand is here to keep my ribs quiet so they don't start to flare or open up. Sip of air, inhale. Exhale, keep the ribs still. Tilt the pelvis away, platforming the sacrum to the top of the roller, nice and heavy and flat. So that was our tuck and tilt. Let's go ahead and bring both of our knees up to our chest. Check that that roller is not going to fly out. You can position your hands to stabilize your hips. Keep the knees on your side of the roller. Don't tip them too far away from you. And we're just going to gently tick-tock our knees back and forth. This is our SI joint shear. We're hydrating the back of the pelvis with this little movement since it is mostly cartilage and fascia and other non-vascular tissue. So this is a good way to get some hydration into an area that doesn't really get a lot of fluid normally. You're making your movements small. Then we're going to go over to one side. Now the opposite knee of the side you're at should be in line with your nose. So if I'm tipped over to the right, my left knee should be in line with my nose. I don't want to go past that. I'm going to make small circles to shear my right SI joint. Go nice and slow. Make sure that you're only moving at the hips, okay? If you notice that your ribs are starting to come off the floor, make your movement smaller. And if you feel any sort of grinding, or if you hear clacking or popping, either go in the other direction or make your movement smaller. Another option you can do is just take your feet for a march. So again, you're keeping your knees slack. Your heels are slack to your butt cheeks. You're not trying to bicycle, right? Just a gentle march in place. This is also a good way to shear the SI joint. Bring your knees back together on your side of the roller. Take a breath into what's contacting the roller. And then let's go to the other side. So now I'm on the left side. My right knee is in line with my nose. I'm going to make some small circles, keeping my knees on my side of the roller. Doesn't matter which direction you go, but you might notice that this feels a little different, this movement on this side compared to the other side. That's okay, it's just information. If you'd like to try the other direction, you can go ahead and switch. And the size of the circles I'm making are about the size of dinner plates. Nothing huge, not wagon wheels, nothing like that. Wagon wheels as in 1920s wagon wheels. Or we can take our feet for a march. Heels are slack to the butt cheeks, and we're gently marching in place, shearing the SI joint that's in contact with the roller. And then we're going to bring our knees back together. Pause, take a breath into the area that's contacting the roller. Now bring your knees back to center. Take your hands, you're going to glide them up your thighs so that way your fingertips wrap around the tops of your knees. And I want you to make sure that you're not curling your shoulders forward. We want to keep our shoulders as close to the ground as possible. So think relaxing the shoulder girdle. I'm not trying to pull my shoulders down and back. I'm just keeping them relaxed, keeping my chest open. And now I'm going to use my arms as fence posts. So when I engage my psoas, that muscle in the deep abdomen connects my spine to my pelvis, I'm using about 20% effort to push my knees into my hands. And my hands are here to prevent myself from coming forward with my knees. Okay? So I'm going to use 20% effort. Heels are still slack to the butt cheeks. And I'm going to practice my tuck and tilt. So I'm going to take a sip of air. And my exhale, I'm going to tuck, bringing the pubic bone in towards the nose. It might feel like my knees go a little bit up towards the ceiling. Inhale a sip of air. Still 20% effort, knees into hands. I'm going to exhale, I'm going to tilt. Platform the sacrum on the top of the roller. Hips are nice and heavy. Inhale a sip of air. Exhale, I'm going to tuck. Still pushing knees into hands, 20% effort. Watch your shoulders if they don't start creeping up. Inhale a sip of air. Exhale, I'm going to tilt. Sacrum gets nice and heavy to the top of the roller. And I'm going to stay here. That was our tuck and tilt challenge. Okay, now we're going to do the actual low back decompress. So I'm still engaging my knees into my hands, 20%. I'm staying in the tilt. I'm going to exhale, and when I exhale, I'm going to make my sh, s, or h sound. Okay, so take a nice six-sided breath. Inhale. Exhale. Hold it there. Inhale one more time. Exhale, different sound. And release that tension. Go ahead and tick-tock the legs a couple times, back and forth. And let's move that roller out from under you and see what kind of changes you made. So that was our low back decompress. What we did by pressing our knees into our hands and then keeping ourselves in the tilt while we contracted through our exhale is we actually end up tractioning the low back, tractioning the spine to create length and movement. So if you lie on your back, notice if that changed your shoulder girdle at all. If you feel like more of your shoulder blades are contacting the ground. Notice about your mid-back. If your mid-rib wall is contacting the ground more than it was before, that's also a sign of change. And then notice, where does the low back curve start? Maybe it started up a little bit higher than it is now. And by doing the low back decompress, if you put your finger in your belly button and then the other hand on your pubic bone, does it feel like your low back curve is between your hands? That's good feedback for you. Take your hands out. Notice if you have two flat, evenly weighted butt cheeks, fluffy, not flat, we don't want flat butts, fluffy, evenly weighted butt cheeks instead of a pokey sacrum or tailbone on the floor. And then finally, did you get both backs of thighs to the ground? Whereas before it might have felt like both were lifted or one was lifted. Maybe you notice that both are on the back of the ground. Notice the changes that you made. So that was making our rebalance sequence coupled with our low back decompress sequence to make these changes. Bend one knee, roll onto your side, come on up to seated. So that is a good practice to do whenever you have the time. Again, the more familiar you get with making those movements and the breath and the pacing, you'll be able to find a pace that works for you. And again, every day is different. So you might notice one day your low back curve feels like a rainbow and other times it feels nice and subtle. So practice this move and I hope it goes well for you.